Welcome to Module 2 of Searching for Web-Based Resources in the Next Public Health Professionals modules. This group of modules will help you learn how to find high-quality information on the web that you can apply to program development, policy writing, and grant writing. This project has been supported with federal funds from the National Library of Medicine, National Institutes of Health, U.S. Department of Health and Human Services. Our objective for this module is to identify additional high-quality web-based resources for public health practice information. Before we start searching, I want to say a couple of things about the process of searching for information. First, searching for evidence is a process. No one conducts a perfect search and finds everything they want the first time. You will need to spend time searching, revising, and searching again until you have what you need or you are sure that it does not exist. Here's our PICO question. For high school students, does education via social media versus standard education have the outcome of decreasing risky behaviors and incidents of STIs? Our first resource is the Community Guide. It is a free resource provided by the Community Preventive Services Task Force, an independent, non-federal panel of public health and prevention experts whose members represent a broad range of research, practice, and policy expertise in community preventive services, public health, health promotion, and disease prevention. The task force provides evidence-based findings and recommendations about community preventive services, programs, and other interventions aimed at improving population health. The Community Guide is designed to help you choose programs and policies to improve health and prevent disease in your community. It contains a collection of online public health materials that will help you assess and carry out evidence-based public health strategies and interventions to meet your community's critical health needs. Let's look at the Community Guide more closely. Two of the most important resources on this site are the topics and publications and resources at the top right of the screen. We'll start with topics. In the topics, you can browse based on your population, such as adolescent health, or by condition, like HVI, STIs, and teen pregnancy. Let's take a look at that link. The fifth result on this page may be relevant to our topic, health communication and social marketing, campaigns that include mass media and health-related product distribution. We note that it is from 2010, so information may be a bit dated. When we click on it, we see a summary, which notes that this is based on strong evidence of effectiveness for producing intended behavior changes. At this point, you may decide to read through all the tabs with the supporting materials and considerations for implementation. Let's go back to the main and take a look at publications and resources more closely. This grouping of materials is organized to support you in the design, implementation, and evaluation of your own project. For example, if you select Community Guide Tools here, you will see resources on community health assessment and evaluation, developing strategic action plans, and a mobilizing for action framework. There are links to needs assessments and evaluation tools to gauge need and effectiveness. Overall, the Community Guide functions as a great starting place for finding evidence-based public health interventions for communities. Now let's turn to another resource. The Centers for Disease Control and Prevention, or CDC, is another resource you've probably visited already at one time or another. There is so much information here, it can be challenging to find anything. But when you know what you're looking for and the source of that information, it can be a little easier. Here's the CDC website. The main page has a few quick access points for public health information that can be easier to navigate. We'll go to Health Topics, the letter S, and then scroll to and select sexually transmitted diseases. Scrolling down this page, you see a box for what's new for adolescents and young adults. Let's look at that. Again, scrolling down the page, there's a report, Adolescence, Technology, and Reducing Risk for HIVs, STDs, and Pregnancy. That seems worth a look. Note on the left side of that page were additional links to projects and initiatives, program management, and tools and materials. Scrolling further down the page, there's even more to explore with STI prevention success stories, reports, fact sheets, and more. Finally, if you're not able to find what you need, you can try the search box as a way of navigating the CDC. For example, let's search sexually transmitted social media, and then we'll look at social media and more. Here we find content, graphics, and customizable infographics your organization could use. Let's search again for another great resource here, the Public Health Professionals Gateway. On this page, you will find news on public health laws, public health systems best practices, training, and more. There is a wealth of material here. There's also a link to the CSTLTS, the Center for State, Tribal, Local, and Territorial Support, which provides excellent information for reaching underserved populations. In conclusion, while the CDC website can be overwhelming, it is an essential health information resource that can help support any public health worker seeking evidence for practice. This concludes the second module of the Online Resources section of the next Public Health course. Please move on to the next module to learn about 2 other important web resources.